Hi, what's on your mind, sir?
Hi, Doc. How you doing?
I think I'm doing okay. Where'd you get the cool name, sir?
Just a nickname I picked up a while back.
All right. Haven't
Kind of
seen it
stuck.
much, so congratulations.
Yeah, I'm calling about my heart. About 15 years ago, about 17 years ago, I had a double bypass, and I'm
Mm-hmm.
aged right now is 56. So I had it when I was 40 years old. So I guess
Oh,
about
I'm
15
sorry.
years.
Yeah.
Yeah, and then I've gotten three stents. The last two I received about 3 years ago in a bilateral procedure.
Mm-hmm.
And so I started taking supplement stuff, but I'm still overweight. My weight bounces up and down, and I want to improve my health so I can get off these medicines or as many as possible. Um, what are I take like sotalol, toprol, clopidogrel, isosorbide, gentoven,
Wee.
and I forget the other one on the top of my head. But I just recently found out gentoven uh, can create a condition where you can have more calcification in your arteries. Is that true?
Well, that's what the researchers say, yeah. I tend to believe
Yeah.
researchers. Mm-hmm.
Yeah. So I am taking some natural multivitamins, and I'm taking some K, vitamin K, but it's a Mark MK7. Try to get better absorption in my system because of the gentoven I'm taking,
Uh-huh. Makes sense.
and so I don't know what else can I do.
Okay, sir. I'm real good at looking up patent medicines online. However, can you please just tell me, because I'm not sure of all these titles, is any one of those a statin medication? So-called
Yes,
statin, which
yeah,
it
I'm on
is.
some statins.
Okay, sir.
And
That's one. Now, I'm definitely going to go over with you what you can do to lower your risk of heart attack and stroke. But we got to talk about the risk of cognitive decline caused by statin medications, sir.
oh, wonderful.
They don't tell you that cholesterol is not just manufactured by our livers. Yes, it is, but it's also manufactured locally in the brain. And
Oh,
what's happening in the brain that needs locally manufactured cholesterol? It's called repair of brain cells. And so there's research articles out there, sir, that show us that statins significantly increase the risk of cognitive decline. And so, in my opinion, nobody should ever go near a statin, particularly since cholesterol is not the one major factor, is not a major yeah, cholesterol is not the primary factor. That's the word I'm looking for in causing the clog in the arteries. What's this? What else is clogging it? Well, I'll get to that in a moment, but statins are not the primary factor. They do cause cognitive decline, and I would stay as far away from those as possible. And here's another thing, sir. It is so sad. It's been in the medical journal since the 19, I believe, 60s, all the way through the 80s and 90s. And what did it say? It said that if you want to downregulate cholesterol, there's this mineral called vanadium, which you can find on the shelf in all the health food stores. And if you want to downregulate cholesterol, which again we'll get to whether we really need to do that or not, but if you want to, there's a mineral that will do the job, and that has been in multiple publications. So why don't we ever hear about it? Because you cannot patent vanadium, make $1 billion, and pay it to a certain federal agency. That's why. And so you can look that up, vanadium and cholesterol control. It's known. It works, in case you're worried about that. Vanadium. Okay, back to
okay.
what's better than statins. Well, I know other folks have heard me carry on about this, but let's do it because it's so important. In the 1990s, here comes a research study publication. It involved 2,300 men, 1,800 women. Everybody's a quote older person, unquote. And what did they do in this research? Nothing at all. They just had permission from these people to keep track of their medical records and see what happened to their health over a 9-year period. Okay. And after 9 years, what was the report? The report was, sir, that the men and women who donated blood on a regular basis had 45% less risk of heart attack and stroke. And I did say 45%. That's a big deal. Now, I'll get to the reasons why after I cover the next study. And the next study was reported from Finland. And that also was 1990s. I believe it was the year after the one I just told you about. This was men only. And these guys were all over 50. And there were 2,800 of them. And since they got socialized medicine over there, everybody can, anybody who gets authority from the government can get into everybody's medical records and look up everything that happens to them. Oh, by the way, did you know that that's the law here in the United States, too? If your doctor keeps electronic medical records, you got to give the federal government a backdoor into them so they can get in and read everybody's records? That's why we only have on-paper records at Thelma Clinic. But back to the Finnish study. They got into all their medical records, and what they found, and do hang on to your chair because this is hard to believe, but there it is. It's right in the statistics. The men who donated blood regularly had 88% less heart attack and stroke over that 9-year period. 88 blinking percent less. Now, I'll take 45% from the American study. This Finnish thing said 88%. Oh my, so why aren't we told? Well, here's one reason. I was talking to some official down at the blood bank in Seattle about something else entirely. And we got done with that conversation. And I asked that official, a lady, I asked her, have you heard of this study done here in the States and the other one done over in Finland about reducing heart attack and stroke risk by this great big amount, by donating blood? Haven't you heard of that? I said, every holiday and some of the days too, we get this plea on the radio, come donate blood, we're running out of blood. Why don't you just tell people about those research studies? They come flocking in there. They want to reduce the risk of heart attack and stroke. They could do themselves some good at the same time they did somebody else some good. What could be better? You know what that lady said? Of course you don't, so I'll tell you. I cannot imagine a person with this kind of attitude, but it came right into my ear, this set of words. We only want people to donate blood for altruistic reasons. Oh, my gosh. And so you're not telling people what might do them some good because you only want people to be altruistic? Can't stand it, sir. Now, how does that work? Let's get to how it works. Well, there's a whole book on this by a cardiologist by the name of Kenneth Kinsey, K-E-N-S-E-Y. That's Kenneth Kinsey, K-E-N-S-E-Y. And what Dr. Kinsey points out is that if you have to be a lady during her menstrual cycling years and you do not smoke cigarettes and you do not take birth control pills, your risk of heart attack is almost zero, and your risk of stroke is almost zero. Women do not start having heart attacks and strokes at anything close to the rate that men do, because zero is pretty far from that, until after the menopause. And after the menopause, any statisticians, such as the ones at the Centers for Disease Control, will tell you by the time women are 65, they're having just as many heart attacks and strokes as men are at age 65. But how come they're not at age 35 or 40? Guys start having heart attacks and stents at age 40. You know about that. How come they're not having that done? Because they're donating blood, in a manner of speaking, once a month. What difference does that make? Okay. The difference, as Dr. Kinsey points it out, is thinner blood. Thinner. It's not as abrasive. There's less red blood corpuscles. There's plenty to keep mom going, taking care of her kids and doing everything, carrying oxygen around and all that kind of stuff. But it's not so thick and abrasive. Men, the only time we ever donated blood is back in the dark ages when we went to battle with each other and whacked each other over the head and got cut and bled all over the place. But other than that, men don't have menstrual cycles, and so our blood is significantly thicker. No kidding. And that thicker blood creates abrasiveness at the branch points in arteries. And remember, sir, you had those stents. Where was the cholesterol accumulating? At the branch points of the coronary arteries, at the branch points of the carotid arteries. In some people, why does that cholesterol accumulate? Because thick blood causes abrasion and inflammation. And there's nobody arguing with this, by the way, sir. There's nobody saying this is BS. They're just ignoring it completely. But they never say it's BS because it's true. And the thicker blood creates abrasion and inflammation. Why at the branch points? Because that's why you never hear of an arm attack. If you've got an artery going straight somewhere and it doesn't branch in two, maybe there's a little bit of erosion at the sides, but not much. But imagine a river coming down a mountain straight down, and yet it hits an island at the bottom. What does it do to the coastline of that island? Yeah, it erodes it. That's called inflammation in human bodies. And since our bodies don't want to have inflammation inside those branch points or inside the arteries, what do? They paste cholesterol over it. So cholesterol is nothing more than the repair plaster for a damaged, inflamed artery. And if we keep allowing our blood to be just as thick as before, us guys, listen, guys, please. If we keep allowing our blood to be just as thick as it was for years and years and years, it's going to continue to abrade. It's going to continue to cause cholesterol accumulation to cover up. It's the plaster that covers up the inflammation. And ladies, after menopause, same thing applies to you. You're not donating blood once a month in a manner of speaking anymore. And so you start abrading your arteries because you're getting thicker blood now. It's not coming out once a month anymore. And so up goes your risk of heart attack and stroke. And even the blood bank people admit they know about this, but they only want people to donate blood for altruistic reasons. So, sir, I know that was a long ramble, but really, 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 really talk to your doctor, skilled and knowledgeable in natural medicine, about how often you personally, because there is a way of checking your blood count and making a good estimation of this, how often you personally should be donating blood and cutting your risk dramatically of future heart attack and stroke. Now, would it hurt to go in 4 times a year? No, it wouldn't, but some people don't need to go in that much, and a few people need to go in that often, and that's why I said check with your physician, skilled and knowledgeable in natural medicine. But 3 or 4 times a year is a good guess for somebody who doesn't want to do that, doesn't want to check with their physician, but again, it's a guess. So anyway, sir, this whole cholesterol myth about cholesterol causing heart attack and stroke is, as my Italian grandmama would say, Bologna. It's exactly that. It's a myth. It's not true. And what the cholesterol is the paste that covers up the abrasive action of the thicker blood that us guys have and postmenopausal women have. And the sooner that news all gets out there, the better it's going to be for those of us who donate blood. And what's even better about this, sir, and I promise I'll shut up shortly, what's even better about this is we're doing ourselves some good and we're doing somebody else some good. Have you ever heard of any politician who can do that? They do somebody else some good with your bucks, not their bucks. But here we'd be doing somebody else some good with our blood and be doing us some good, ourselves some good by donating it. Okay, time for me to shut up.
Well, thank you. That's very informative. So I had 2 questions. One, I'm on all these medications, so would they accept taking blood from me?
Probably not. And so that's where a lot of the doctors in our area who do natural medicine will do something called therapeutic phlebotomy, which is just fancy words for taking a pint of blood and leaving you with thinner blood. And yes, the blood is disposed of in a way that is, what shall I say, ecologically sound. We'll put it that way. Or you can take that pint of blood home with you and dig a big old deep hole, and maybe 3 feet deep, because dogs can smell blood if it's right at the surface, and put it down in that hole and plant a rose bush. And, sir, I have personal observation from a woman who did that with every placenta from her babies at childbirth. And she had the most beautiful rose bushes I have ever seen. And since I didn't have any placenta, not being a lady, I decided to try that with a pint of blood I'd donated, because I do this regularly myself. And what do you know? It does make beautiful roses, but make sure you put it in pretty deep so the dog doesn't dig it up.
Okay. So my other question is on the Vanadium, how much do I determine to take?
Let me spell it for you, sir. It's Vanadium. V-A-N.
Oh, Vanadium, sorry.
Yeah, no problem. V-A-N-A-D-I-U-M. Well, very weird thing, sir, but the manufacturers of vanadium have read the research articles, and so their little tablets or capsules, depending on which company you get, are just the right size to be using one a day, and I would not be using one a day unless I checked with a doctor skilled and knowledgeable in natural medicine, got my vanadium levels measured, which you can do with a hair mineral test. And then some people do need more and to get themselves up to an average for the population. But there it is in all the natural food stores, sir. If you want to use it, my opinion is we just ought to regard the cholesterol as the plaster, and we ought to work on why the blood's abrasive.
Okay. Well, thank you. That's very helpful, and I appreciate it. And you have a good day, sir.
You're welcome, sir, and thank you for your patience and listen to me carry on about that.